name's Rahee. I am a third-year medical student at the University of Washington.
I'm Nafely. I am an RN-ED, so I am a registered nurse in the emergency department.
My name is Riley. I'm currently in a master's program for occupational therapy at Washington University in St. Louis.
My name is Jonathan Luong. I'm a recent graduate of the University of Washington with a degree in biochemistry. I currently work as a pharmacy technician in a community pharmacy, and I am applying to pharmacy school this year.
My educational experience includes 4 years of undergrad. I went to Washington University in St. Louis. I had a major in psychology with a concentration in child psychology, as well as a minor in biology. I'm hoping to be an OBGYN, so that would be an additional 4 years of residency after 4 years of medical school, which is following 4 years of undergrad.
It took me about 2 years because I took the ADN route. Eventually I do have to get my BSN. Most hospitals are the same way. They can hire you as an ADN, but eventually they do need you to get your BSN. And that only takes around 4 quarters, and they most likely will help you pay for it.
So I did 4 years of undergrad, and then my master's program is 2 years of coursework, and then 6 months of a full-time internship, which we call field work.
Pharmacy school is typically 4 years, with your fourth year being a series of rotations or sort of just clinical internships. So not much of it is in the classroom, actually. It's getting real-life experience working as a pharmacist. But you technically do not need a 4-year degree or a college degree in order to apply for pharmacy school.
There's a few different reasons that I decided to be a doctor. Obviously I want to help people and make the world a better place, and I realized that as a doctor, you really get to teach people. You're constantly teaching your patients how to be healthier, recommending treatments and helping your patients understand why you're recommending those things. And you also really get to be an advocate, and this is really important, I think, to being a doctor. And finally, you have the opportunity to be a leader. There's so many different people who make up a care team. As a doctor, you're really the leader of that team, and that doesn't mean that you make all the decisions, but you get to help the team come together and help to be a leader for your patients.
I chose nursing because I love the human anatomy. I love each organ and how it works as its own system, but together it makes life. I chose the emergency department because it's exciting, it's fast-paced, it's educational. You learn things that you've seen in the textbook, and you've learned things that you've never heard of before, and that's very exciting to wake up to every day.
I majored in psychology and sociology at UW, and I kind of had no idea what I wanted to do with it. I knew that I was interested in working with people, helping people, but the great thing about OT is that there's so many different patient populations that you can work with. The more that I learned about OT, the more I fell in love with it. So I wasn't sure if I'd end up in the medical field, but here I am.
What initially made me interested in working in the field of healthcare was specifically I think it's just a very great intersection of the sciences, and having your work, so directly benefit people in an impactful way, I think is very rewarding. Specifically for me, I want to work in pharmacy informatics, so that's kind of the process of working with healthcare data and patient data and using that to inform decisions that healthcare professionals make.
I think a common misconception about being a doctor is that in order to get into medical school, you have to follow this kind of prescribed route of education. Major in biology and then take the MCAT and then go straight into medical school. That's a real misconception. I have so many classmates, including myself, who took many years off before coming into medical school. It's important to know that as an undergrad, it's okay if you take a path that is not kind of the thing that everyone else is doing.
A misconception about nursing is that we don't do much. The doctors spend about 10 to 20 minutes inside a patient's room collecting all the details that they can see and creating a plan of care. We nurses, we actually take that plan of care and put it to action. So we do all the treatments. We make sure the treatments are done, and then we record the results to make sure that it is according to plan so that we can get the patients home.
I feel like a common misconception about people in the medical field in general is that they're really kind of into just diagnosing and treating and don't see the human side to healthcare. But in OT, I think the biggest issue is that a lot of people don't know what it is. People think that it has to do with helping people find a job, which can be part of it because it's helping people do what they want and need to do. that it can be a lot of things. It's not just about work.
If you go to like a Walgreens or Rite Aid, you see pharmacists practicing there, but I think a lot of people don't really recognize or realize that a lot of pharmacists, they also practice in a lot of different other capacities as well. So you have like clinical pharmacists who work in a hospital, you have people who work in compounding pharmacies, and people who work as pharmacists, creating chemotherapy treatments. So I think a very understated portion of practicing as a pharmacist is, public health and preventative care and, keeping people healthy.
COVID has changed a lot about how we process things in the ER. As soon as you walk into the door, we have masks that are required, and we have hand sanitizer stations everywhere. We're wiping down things constantly between patients. If you do have any of the symptoms, or if you're already COVID positive or you're a person under investigation, you get put into a COVID zone, and all the nurses and all the staff are required to gown up and limit their time into the rooms. It's hard to kind of build that relationship with the patient because you only see my eyes. Everything else is covered. My voice is even kind of masked. It's kind of hard to build a patient relationship with that, but we're doing the best we can, and hopefully this will all soon pass.
As an OT student, COVID-19 definitely impacted the way that I learn and go to school. We transitioned to all online learning, so that was very different and difficult because in OT there's a lot of very hands-on things. For OTs who are actually out there in the field, there's a lot more telehealth, especially for school OTs, so it's really changed the profession.
I think that COVID has really revealed that there is a lot of misconceptions and miseducation, not just specifically surrounding this virus, but surrounding healthcare in general. And people are just generally very unaware of, proper public health standards or procedures that, were important before we even had coronavirus. So I think it's important that this is something that we educate people about in order to ensure that something like this is, minimized if it ever happens again in the future.
The advice that I would give to students who are wanting to pursue a career in medicine is to never give up and just to keep trying. It's a hard process. It's a hard road to be on. I applied to medical school. I did not get in. I had to retake the MCAT. I had to continue taking classes and keep on trying. And I finally got in. I'm happy to be where I am now. But at the time it was really discouraging. So I just want to say, don't give up. Don't compare yourself to other people. Just keep trying if it's what you want, and you'll get to where you're meant to be.
One piece of advice I can give is get experience before you graduate. So whether it being a CNA or tech, go into the hospital that you think you want to be a nurse in. See how it's like working there. You learn a lot of things such as bedside manner, prioritizing, and time management. And also it looks better on your resume because not only are you somebody on a piece of paper, but it's somebody that they've already had past experience with. So they know your work ethic and they know who you are as a person.
The biggest piece of advice that I have for anyone who's interested in pursuing a career in the medical field would be to just get as much exposure as you can. All the reading and research doesn't substitute for actually shadowing and being there in person, because then you really get the sense of day-to-day what the job is like. And also just don't feel pressure, don't feel like, you should pursue a certain career because of the prestige or because of the money in order for it to be a sustainable long-term endeavor, because it's going to be a lot of work no matter what. It really has to be something that you love and that you're passionate about.
The medical field is a very diverse field. There's a lot of different ways you can practice and a lot of different ways that you can make an impact. I knew I never really wanted to be a doctor, but I knew I wanted to work in the healthcare field. What helped me was, talking to mentors that you may build, through extracurriculars, through volunteering, through shadowing. I think those are really valuable relationships that you should try to, keep close to you. And it'll be really hard, there's going to be a lot of hard work involved. But I think if it's something that, you're really passionate about, really serious about, then that's something that you're going to understand and be willing to take on, and you're going to work through it and be better for it.